more casual about being on time.
Correct. Hi, everyone, and welcome. I think we will begin. This is our first Eastman Lunch and Learn for 2022. For those of you who have been following us, we took a little bit of a hiatus after we did the COVID-19 series, but we do have a full schedule for 2022. We'll begin it with video, obviously. Hopefully, at some point, we'll actually get back to in person again, but for now, we'll have to Zoom. That being said, just some reminders about how this particular webinar works. This is set up so that this is going to answer a question that just came up. This webinar is set up so that you do not have video and you also do not have audio. This is purely something where you will hear myself or perhaps Paul, who's one of the panelists, and Lora, our speaker. However, that being said, we do encourage questions, and it's a lot easier for Paul, who's monitoring things, to have you do your questions through the Q&A, and you should see Q&A on your panel of various items. So if you don't mind, anytime during the talk, putting a question in Q&A, Paul will be compiling them, and he will then be telling Lora when there are questions. So that's how these work. This is the Eastman Cares education team, and I thank all of them for their help. A couple things I usually do at the beginning of this is to say a reminder to people that Eastman Cares has a resource guide, which was updated in the fall. And I normally hold one up, but of course I can't find mine at the moment. But they are available both online at the website or by going down to South Cove. So please take advantage of that. The other reminder I usually do is to tell people about the Eastman Cares Connection. That is something relatively new within the last year or two, whereby if you know someone who you think would like to just talk, this relates actually to the talk that Lora is doing, someone who just needs to talk to someone, whether it's weekly, whether it's daily, whether it's monthly, whatever. We do have people who are volunteering to do that. And it can be anybody, you don't have to be living alone, like anyone can take advantage of this service. Please, if you're interested, it's Eastman Cares at eastmannh.org. I'll do this later again as a reminder. Let's see. And in terms of evaluation, when we had these things and we were actually physically there, we had evaluation forms, and obviously we can't do that this way. However, we do encourage people to submit comments to us. Same thing, Eastman Cares at eastmannh.org. So we're very happy to receive any comments or any evaluation about these sessions. This is being recorded, and the recordings are posted on the Eastman Cares website, and that includes all the past ones as well, so that if you want to catch up or you know someone who missed this, that's where you can actually go to hear it. Before I introduce our speaker, I would like to say that our next talk in February is going to be presented by the West Central Behavioral Health folks, and they're going to talk to us a little bit about their mobile health crises services. And I'm really looking forward to that one as well. Let me tell you a little bit about our speaker. I'm very excited to work with Lora. And we've been working actually for the past couple of years, but then COVID hit and we haven't been able to do anything, but now we're trying to get back together again. Lora is the program leader for the Northern New England Geriatric Education Center at the Dartmouth Centers for Health and Aging. So she's responsible for planning and delivering educational activities for healthcare professionals, and she will be telling me a little bit about this, as well as members of the public. And she has a particular focus on falls prevention, decluttering, mindful art, advanced care planning, and caring for individuals living with dementia. Her educational background includes healthcare administration, health policy, program evaluation, and qualitative and quantitative research methods. Currently, she's president, this I actually didn't know. Currently, she's president of the New England Rural Health Association. And as I love, she's actually a speaker who gave us some personal information. So this is not just all about credentials, which is obviously very nice, but it's also nice to have something personal. So she loves traveling and visiting cities, but she always wanted to come home to a rural place. Though she was raised in North Carolina, New England is her home. She has two wonderful, beautiful daughters here. They like to camp and kayak and be by the fire pit, and they're very involved with nature. She's a self-taught artist, and if you follow the Aging Resource Center, you'll see some courses that she offers on, let's see, Zentangle, I think, and Mandela, but she'll probably talk about that as well. That's been one of her greatest joys, is actually teaching art to older adults online. They even had a virtual art show, and there is an Eastmanite I know who has actually taken part of these classes and the art show. She lives in Grantham, and she's in a belly dance performance troupe. And I was really taken by the sort of last sentence on her intro here. And it is, as many of the older adults I work with would probably agree, learning and growing throughout life is a wonderful part of the journey. And you are never too old to play. And on that note, I think I will turn this over to Lora. Welcome.
Thank you very much, Sue. Happy to be here today. Little bit of a heavy topic, but I think a very important one. I'm going to be talking about kind of emotional health in the pandemic, because we've seen some real changes, of course, as we have been physically distancing. I prefer to say physically distanced rather than socially distanced, because that's really what we're talking about. But I'm sure everyone here has experienced many changes, and it's been a lot to adapt to. So the things that I want to really cover today, I want to describe what social isolation and loneliness are. Both of those things have been exacerbated by needing to physically distance. I'm also going to discuss the impact of ageism. The pandemic has really heightened ageism, and ageism does have an impact on our health. And I will also talk about some approaches to reduce social isolation. There's no magic solution, but there's definitely things that we can do. So what is solitude? Solitude is spending time alone to reflect and become grounded. It's something that people choose to do, and it's not a negative thing. And how much solitude someone wants or needs really will vary a lot by the individual. So just being alone is not a bad thing. It's how we respond to being alone. And a little solitude is good for everybody. Social isolation is something that we can kind of measure. There's disagreement about exactly how to measure it in the scientific community, but it is something that we can measure based on the number and quality of relationships that someone has. How many social contacts do they have? Do they have people in their community that they connect to, or in their life that they connect to? And there's not one definition, but someone who's socially isolated would be someone who has few of those meaningful social contacts and a more limited network for support. Loneliness is a feeling or an experience, and kind of in response to these things, in response to the degree of isolation. And it's the perceived lack of adequate social connections, and that's subjective based on the individual. One person really may only need one or two friends, and that makes them feel fulfilled and complete. Other people may need far more. So it really is about the individual and the kind of relationships that they desire. And when someone is lonely, it's because there's a difference between the number of relationships that they have and the number that they would really want to have. So that's more the definition of loneliness. And there's a couple of different kinds of loneliness. Reactive loneliness is what happens kind of in a normal life transition. The death of a loved one can create loneliness, changes in your family, a move to a new community where you don't know anyone. So all of those can cause loneliness, but usually it's something that someone's going to transition back out of. They'll make friends, they'll develop new social connections. Chronic loneliness is really having a lack of a social circle in general, and it's a longer term situation. And somebody may not have the emotional, mental, or financial resources to get out of this cycle. Sometimes loneliness can become a real self-perpetuating thing where someone will withdraw ever more and not be able to get out of it. And it really has negative health consequences. There's disagreement in the scientific community about exactly why, but they definitely know that a relationship exists and it's pretty significant. And one term that I'll use here and there is social determinant of health. So I just wanted to make sure that I defined that. Loneliness is a social determinant of health. And what that means is that the conditions of someone's environment, and that can be their social, their physical, or their economic environment, how it shapes their physical and mental health. So there's no pill to cure low income or somebody who's in poverty. You can't get an injection and be able to have transportation. So all of those sorts of things.
You need a new computer.
Can you mute, Sue?
Oh, I'm sorry.
That's okay.
I'm sorry.
So there's no way there's not a fix that one individual can necessarily do. These things all impact people's health. So something that I liked that made sense to me is that loneliness is like a fertilizer for other diseases or medical conditions. It's linked to a variety of mental and physical health problems. And if somebody already has an issue, a physical or mental health issue, loneliness can allow those conditions to get worse. So here are just a few. This is not even a comprehensive list, but these are kind of the big ones. These are some of the things that are associated with loneliness that can occur: depression and anxiety, poor sleep, impaired executive functioning. So someone's ability to kind of plan things out, do things in a logical order might become sort of impaired. If somebody's experiencing some cognitive declines, it can really accelerate if that person has limited social contacts. Cardiovascular function declines. It can lower the immunity system. People may become inclined to have less physical activity. People may become overweight. Increased smoking and alcohol use. It leads to people being placed in nursing facilities. And unfortunately, there's lots of problems with loneliness in facilities and increased mortality. So this is a very significant factor in our health. And there's been various studies on how it compares, and it's various organizations or institutions have found connections. It's just as bad for us as being obese. It's just as bad as smoking 15 cigarettes per day. It has the same kind of impacts as lack of access to healthcare, as well as physical inactivity. So these are things that people think of a lot more commonly as health factors, but loneliness is still very significant. So social isolation. Let me move this around here. It's something that was increasing in America even before the pandemic. Right now in America, about a quarter of the population lives alone. About half the population is unmarried and does not have a significant other living in the home or a marriage partner living in the home. As a society, we're having fewer children, and children are also moving further away. So families are becoming very spread out. Volunteerism in general has gone down. That used to be a good social outlet for people. And an increasing number of people report no religious affiliation. And New England, I think in general, is also pretty low as far as people who report a religious affiliation. And then, of course, into this mix that we already had came the pandemic. And I had to update the year. I've used this presentation elsewhere and it said 2020 to 2021. And I had to update to the 2 because we're still there, unfortunately. And there's a few factors really that impact older adults in rural areas. I live in Grantham, and so we are in a rural area. We're surrounded by rural on all sides. And what we see in rural areas are that people are older on average than in urban areas. There is more physical isolation. If somebody lives down that slippery uphill dirt road and it's snow covered, they become more physically isolated. It takes longer to get out and do anything or go visit people. People in rural areas tend to have more underlying health conditions. Oftentimes there's less economic support or resources, and we have fewer services in general. So social isolation in older adults in particular, there's actually some evidence that younger people are actually more impacted by social isolation than older folks, but we definitely see that older adults, 24% report that they are socially isolated in the US. And there's some factors that go into the older adult experience. Retirement from a job is a big one. There's a lot of social connections that we may take for granted when we're in the workplace, and then all of a sudden, most of those disappear. That's a very big adjustment. I know my own father had to adjust. He retired and really had no plan and was drifting into watching a whole lot of television, not really doing much. And so he kind of went back. He's now a pickleball champ and got out and was much happier once he sort of had a plan for how to keep himself busy and active. Sometimes we have more physical limitations as we age that really prevent us from getting out and about. People will lose family and friends over time. Hearing loss can be a big one. If someone's not aware that they have hearing loss or they don't have adequate support to manage hearing loss, it can really socially isolate people. So that's an important one to check for with your healthcare provider. Sometimes people need to cease driving or driving at night, and that can limit their ability to have social contact. And we don't have fantastic transportation access. That's quite an issue in rural areas, and hopefully that will get better and better over time, but it can still be a limiting factor. Having less income can reduce opportunities to do things. And the COVID impact, we had all of these kind of pre-existing issues, and then grocery shopping became much more challenging. Running errands became more challenging. Access to healthcare has been a very significant issue. Getting appointments, getting to appointments. Some in-home assistance that was available before, whatever it is, somebody coming into your home to help with something, some of that needed to stop. We've got workforce shortages, so that's limiting hours, it's limiting healthcare access, again with transportation, and then certainly some people do have less access to the internet. And we definitely saw an increase in social isolation and loneliness during the pandemic. Some people are not bothered by social isolation. They may have been fairly solo people already, and it was not a big transition, and that's okay. They may not feel increased loneliness, or it's at a manageable level. But there were a lot of other people who may have very rarely experienced isolation, perhaps very social, active people, and they began to feel lonely or did not have the supports that they were used to. It was a big change for those people. And some people who maybe had just enough social contact might have found those significantly reduced as well, or just gone. And so it's big change for many people, but there are some people out there who are content with those situations. But just to give an example, somebody who might be providing care to someone living with dementia, was formerly able to get a few hours of respite care from outside the home each week. And then that service went away. And this is something that we know is a very real issue. This is based on some of our clients at the Aging Resource Center. So that no longer could get respite. And now the care partner is not able to meet her friend that she sees each week. She can't attend her in-person support group for care partners. And now even her son is doing her grocery shopping. So she doesn't even get to go to the store and have those little interactions, chats with a stranger, smiling at a child, whatever it was, just being out and with people. And so all of a sudden, these little supports that she was able to count on are just missing. And of course, we've also had sort of these other supercharged environmental factors that are draining on all of us, no matter where we stand on the political spectrum or where we stand on anything. It's been a time of stress. And we are seeing very widespread mental health issues across the population, all ages. We're seeing people have increased depression and anxiety, increased substance use, an increase in suicide. So we've got all of these factors kind of already at play, and lots of concerns about safety, which leads to fear and worry and stress. Might be worried for ourselves, might be worried for our families, might be just tired of things changing. It's a lot of stress to deal with. We've had a lot of natural events. Perhaps there's family members living in these places. We've had a lot of hurricanes, floods, fires. That's a stressor. And we're seeing a lot of conflicts within our society. And some of that impacts friends and families that are having arguments about things that they never argued about before. So we've kind of got this storm of factors happening right now. So what can we do to help with social isolation and loneliness? None of these are going to seem like new or innovative, but there are things that we can do. And sometimes it's just about getting out and doing them. So joining a group, a class, some kind of interest group that you have, or a support group. I can attest, because I do teach a lot of classes and I lead some support groups online. Groups really can bond online. There's people that I've never met in person, and I feel that I know them very well, especially any kind of group that's really discussion based and where you meet on a regular basis. It's really real, and I've been very happy about that. A comprehensive list is available if you search for this Boosters for Joy document from AARP. They kind of looked around and have a lot of suggestions about volunteer opportunities, groups that people can join, places where there's classes. It's not going to be everything in the country, of course, but it's a great list to start with. And then there's lots of local options. You've got things like this that you're participating in today. I'll talk more about the Aging Resource Center and what we offer. I know that a lot of senior centers have been offering online programs. So there's a lot out there. Local museums are offering programs. So there's definitely lots of things to do. Try to remember that being physically distanced is not the same as being socially distanced. I mentioned that before, but we don't have to socially distance. We just have to physically distance. We just have to find new ways to do social interactions. It's great to try something new. I think this is good for our bodies and our minds. Now might be the time to learn to do that thing that you always wanted to do. Signing up for friendly visitor calls. So Sue mentioned that Eastman has something set up for this. We also do at the Aging Resource Center, where it doesn't matter how often the person wants it. We can't do a daily check-in, but weekly at least. We call people. We have very lovely staff who call folks and just have a chat and see how they're doing. There's also the Institute on Aging's Friendship Line, and that's actually, I think, a 24/7 thing, and you can call that number and have somebody to talk to. And it can just be about feeling alone. It can be just to have a chat with somebody about anything because you're feeling a little low. Connecting with your friends and family, even if it's over the phone. Some people consider a shared housing situation. It's possible that you would be able to live with somebody who's in a similar phase of life and have a shared home with someone, just for some company. There's also various programs out there for intergenerational housing where an older adult will live with a young person who might do a little bit of assistance in the home. So there's some programs out there to kind of match people up. Volunteerism is a great way to have social connections, and there are ways to volunteer online. And that AARP document that I mentioned does have some options for that. Using social media really for constructive purposes, like actual connections with people. As the parent of a 13-year-old, I'm very aware of all of the various challenges with social media and using it in a healthy way, but just be aware of that and use it for good. And then distraction is actually okay. If you enjoy reading, if you enjoy watching television shows or movies, listening to the radio, all of those things are okay. But just be mindful if it becomes the only coping mechanism and other activities are being dropped, just to kind of do these diversions. Just mix it up. Having a schedule and structure, and maybe actually building in regular contact with people. Don't just wait until the mood strikes you to get in touch with somebody. Go ahead and build in a Tuesday evening call with someone in your life. And I really struggled with this at the beginning of the pandemic, because we were all sent home March 13th to work from home. And I enjoy working from home. And I thought, it's going to be great. The house is going to be clean, run a little laundry at lunch, whatever it is. And it didn't work out that way. And I realized that I was feeling a lot of stress just because that normal structure to my day was gone. I had my working hours, but everything else just kind of flowed into each other. And it became hard to shut down the computer and attend to other things. Whereas before, when I came home from work, I had certain things that I did each day. So that was kind of an interesting insight I had into my own life. And it's definitely a recommendation for people who are facing loneliness, is keep that structure, do some things each day. If you are able to care for it physically and financially, pets can, in fact, be great companions. Exercising, eating well, sleeping well, and getting outside, all of those basic things to maintain our health can really help mitigate the impact of social isolation. And then monitoring your mood and emotions. And if things are really extending for a long time and your behavior is changing, maybe you're not doing things that you used to enjoy, then it's probably time to talk to your healthcare provider. And I'll also talk about some other resources that you can contact, or if you know someone else who's seems to be struggling, then they can get in touch with them as well. So here are a few resources. The Substance Abuse and Mental Health Services Administration has a national referral line, and somebody can get in touch with them if they think that they're having some kind of a mental health issue and get referrals to local treatment options. So that's available to anyone at the national level. New Hampshire NAMI, which is the National Alliance on Mental Illness, has a info line. It's not staffed, so you won't get an actual person necessarily when you call, but you can leave a message or send an email and they will get back to you about the resources in your area. That's also not a crisis service, and neither is the substance abuse and mental health one. It's for referrals. Again, that National Institute on Aging Friendship line, that's a line you can call anytime if you just need a friendly voice on the other end of the phone. And the National Suicide Prevention Lifeline, which is a 24/7 hotline and can provide support if you believe that somebody might be thinking about suicide. And we also have a program particular to New Hampshire. It's called the REAP program, and that stands for Referral, Education, Assistance, and Prevention. They work through different organizations throughout the state and have people who are trained to help with depression, anxiety, and substance use. So this can be a really good resource for people. Sue, did you want to mention anything that about Eastman Cares related to any of these things, or did you cover it? Not sure if she's there.
I'm just unmuted myself. No, I think you've done a good job of covering. I mean, we are going to hear more from the West Central Behavioral folks about their mobile crisis services. So I would just say stay tuned for that next month.
Yep. So another thing that has been really highlighted is ageism. And ageism, there's not one definition, but it's sort of how our society thinks about older people. And typically that's based on negative attitudes and stereotypes about aging. It can be also any blanket stereotyping that we do based on someone's age or generation. We've heard about kind of these boomer and millennial tensions. So we kind of already had some of this happening. All of that I would lump into ageism. Ageism can be institutional. That might be where organization typically doesn't hire older people. It could be person to person. So if I was to speak very condescendingly to someone who was older as though they were a child, I would be exhibiting individual ageism. And it can also be self-directed or internalized. And that would be someone who really has a fear of the aging process, really associates aging with not being well. So that's kind of internalized aging. And that one can actually cause quite a bit of harm. And unfortunately, this is sort of one of it's still sort of socially acceptable to be ageist. I was watching a comedian on YouTube, and he had a set of jokes that were pretty derogatory towards older people. And I bet most of the audience didn't really see anything wrong with that. Unfortunately, this is still fairly accepted in our society. And I will give you some resources later that you can go and learn more about this. And we need to sort of combat ageism in a lot of different ways, individually looking at ourselves and thinking about where we might exhibit some ageist beliefs, calling it out when somebody treats somebody else poorly because they're older. So there's lots of ways to work on this, and I'll provide some resources. But unfortunately, it's a very present and common belief. And about half the world, according to a study by the World Health Organization, has ageist beliefs that are negative towards older adults. And it turns out ageism is also a really important social determinant of health. Yale School of Public Health did a review of 422 studies from around the world. And based on that review, these are some of the things that rose to the surface as common themes. These negative age stereotypes really cause stress to older adults, and we may not even be consciously aware of that, but it still is a factor at play, and it can really, that stress can have a significant impact on health. I think a lot of people are familiar with the fact that stress is a negative for health, but maybe not thinking about some of these more invisible causes of stress. It seems to lead to an increase in mental health conditions, including depression. With people who have some internalized ageism, maybe they don't get treatment for something because they think this is just something that happens to older adults. Maybe they fall and just say that's how it is, rather than doing something to proactively prevent falls. And that kind of belief can lead to up to a 7.5-year shorter life expectancy. So they've actually looked at people and measured how much internalized ageism they have, and found that it actually can take years off your life. In some cases, older adults might be denied access to certain healthcare treatments. There's an increased risk behavior, such as poor diet, alcohol and nicotine use, and reduced quality of life, increase in loneliness and isolation. Cognitive impairment can worsen, and it can also lead to physical illnesses. So ageism is not just a social big deal, it's a healthcare big deal. And what happened during the pandemic is it really let some of these beliefs sort of bubble to the surface. So these are some of the things that we heard. These messages can come from a variety of places, but they were all out there in social media, in the media. COVID is a disease old, frail people get. Other than nursing home workers, really no one needs to take it that seriously. I found out when I was doing a little work around this topic that in France, early on in the pandemic, they did not even report deaths from nursing homes as COVID deaths. It's like they didn't even matter. They've corrected that now, but it's an example where an entire country did something pretty important by not counting those deaths. It really kind of makes a statement. Older people can just be isolated indefinitely, so the rest of us can go about our business. ICU beds should be used for those who have a chance of surviving and benefiting society. Why should the young have to bear the burden of protecting the old? Old people are weak and afraid. Grandparents should be okay with dying if it means their grandchildren can be happier. COVID is culling the weak and those who are a drain on society. And then some of the most toxic stuff I saw were these hashtags that were used on social media, boomer remover and boomer doomer. And you could even get hats and t-shirts. So this was some segments of the population saying that they were kind of happy that older adults were dying of this disease. So this is obviously some pretty terrible stuff that people felt comfortable putting out there. And we saw this also in media portrayals. So these are all pictures that I found in articles about older adults and the pandemic. And because I work with older adults, when I look at these images, I like them. I think that they are beautiful. But the message that a lot of people will get is that older people, are mostly alone in these photos, that they're frail, that they're, already ill. And there's actually a group in England who is doing a social media campaign called No More Old Wrinkly Hands, because this type of imagery is so prevalent in representing older adults. And certainly some much more positive images could have been used instead. And there were some good things, or are some good things that have occurred. Things like special shopping hours for older adults. Some of these programs that many places have done to reduce social isolation through pen pal programs or phone calls. People delivering goods so that older folks could maintain social distance. Development of programs and services for online programs focused on older adults, trying to protect people in nursing homes with pretty strict policies. And many older adults are definitely able to utilize technology. So all of these are some things that did communicate that we believe older adults deserve protection and have needs that society needs to address. But on the other hand, it can also sort of further reinforce beliefs that older adults are frail and dependent, which is not a thing that we want to really have an image of. It's not always the case. And then there was always kind of this stereotype that older adults won't get online. And yes, they absolutely do. Not everyone can or wants to, but 68% of people 65 and older have an internet subscription. And 24% of all ages living in rural areas sometimes have major problems with their internet. So that's an issue that we need the infrastructure to deal with. But people absolutely could get online and have been doing so in droves. So here are some resources that you can search for if you're interested in learning more about ageism and how to combat it in various ways, different ways to talk about it with others. So all of these are interesting resources that are meant kind of for the public to be able to work on this issue. So I'll talk a little bit about our programs at the Aging Resource Centers. Perhaps some of you have already participated in them. We have a lot of classes and workshops, all kinds of topics. We do have one-to-one consultations available for people who are facing any issue that's associated with aging. And we both have a general resource specialist who helps with all kinds of things. And we have a dementia resource specialist who can help you if you have a dementia diagnosis or are caring for somebody living with dementia. We have support groups for bereavement, for care partners, taking care of someone else. We do a lot of advanced care planning facilitation. So somebody who wants to complete their advanced directive will be matched with either one of our staff or volunteers and can work through your advanced directive documents with you. We have a chaplain who focuses really on issues that older adults experience where they might need some spiritual support. We do have some exercise programs that are delivered on Zoom. Those are largely full, but we are trying to make some more space to have more people join those programs. And we do the friendly check-in calls that I mentioned. And these programs are currently still all offered online. We were moving back towards reopening, but have now kind of had to batten the hatches again. But we have been doing a full suite of programs really since the end of March 2020. So we have a lot of offerings. They're free. You do not have to receive health care at Dartmouth Hitchcock to participate in these programs. So if you're not on our mailing list already, there's some contact information, and our website is a great place to start to see what we offer. And one thing that was really interesting that happened is this is how our geographic distribution changed after we started offering programs online. So you can see that we largely did New Hampshire and Vermont, as would make sense, with a few people participating at a distance. Now we've got participants all over the country and also the world. And that counts for you all too. So if there's something that you want to join in California, there's a lot more opportunities now. So this kind of is a two-way street. We're serving a much broader audience, and then other places are also serving people living in New Hampshire. And I think that's pretty much what I had, actually. So are there any questions, comments, thoughts?
Remarkably, we have yet to have anything into the Q&A or the chat. But if I may take a prerogative as a panelist and just ask you a question to follow up when you were talking about social isolation and the use of, I guess, the use of social media. Are there resources that help people use social media constructively? And maybe the second part of that question is, are there resources to learn how to protect yourself from bad actors?
Yes, and actually, I'll kind of pitch our program again, and talk about the process of getting people online. So initially in the pandemic, what we did is big group classes, and we looked at all these different platforms. So we had a class on how to use Google Meet. We had a class on how to use WebEx. Zoom came out as the clear winner, although we still have people who are using other platforms. But we kind of stopped doing those big group classes, and now we do one-to-one tech coaching. And so someone can sign up for an appointment, and I think part of that discussion can be setting up social media and keeping it safe. We have a lot of classes about fraud prevention and scams. That's something to definitely be aware of. So we have legal experts who come in and discuss a lot of these things. So that's a program offering. And unfortunately, because these scams and schemes are always changing. You have to keep up with it. It's not a one and done, because they get better and better at it all the time. I'm not sure of one clearinghouse of information, but I'm sure that there's a lot of guidance out there about identifying scams and online safety. But unfortunately, I'm not aware of a catch-all resource for everything off the top of my head. But I bet AARP has quite a bit of information as well.
Are local police a good source for the scams and fraud, or would you direct people elsewhere? I mean, it may not be heavily staffed.
Yes, I mean, I certainly get the Grantham News, and they pretty routinely post about scams that they're aware of. Some of those are phone calls that come in. Some of them are online. So yes, I think when they're aware of something that somebody has reported in the local area, at least in Grantham, they seem to be pretty good about getting word out. But there's just so many of these, unfortunately, and people are always testing the waters and trying something new. So it's hard to keep on top of it, but.
I think that being said, we did a program on this with the local police department, but it was now probably a couple of years ago. So it may be time to revisit that.
Mm-hmm. Yep.
You have a question?
There is a question. Let's see. Ken Dolkart is asking, this is regarding social media and scheduled weekly Zoom meetings with family or friends. These can be very valuable for seniors via iPads, phones, or other inexpensive measures. Many seniors are at a distance from concerned family members.
Mm-hmm.
This should be a high priority in such situations.
Yes, and I would agree with Dr. Dolkart that this scheduled thing can be really important. Just having it on the schedule and in the calendar, and having that really regular contact to look forward to and know when it's happening. I think that can really be beneficial to people rather than just, oh, I'll call when I have time. Go ahead and schedule it. I think that takes a big step towards more regular contact. And yes, I definitely understand what Richard is saying. It's been a real roller coaster. That's why I used a roller coaster at the beginning of this presentation, is because it sure does feel like that. And it's very difficult for a lot of us to kind of see the light at the end of the tunnel and just then see it move further away. So this is an issue that is ongoing, and continue to be monitoring yourself and seeing how you're feeling, because I think a lot of times we can just, okay, this will alleviate, and we can get stuck there rather than moving forward and trying to find some solutions.
Any other questions, anyone? Well, I definitely want to thank Lora for a wonderful presentation, and a very timely presentation for sure. And I want to again remind people that if you want to see this again, if you have someone else who's missed it, it is recorded, and it will be on the Eastman Cares website, thanks to Lori McClory. And if you do have comments about this presentation, any presentation really, now or in the future, by all means, contact us at eastmancares@eastmannh.org, and we'll be happy to hear from you. And on that note, I would also encourage people to check out the Aging Resource Center if you don't know anything about it. They are an amazing resource, and I want to thank Lora and the people at the Aging Resource Center for being willing to work with us to be able to provide something. So by all means, check out what they provide. They're all free, and there's some really wonderful programs on there. And on that note, is there anything else? I don't think so.
All right.
On that note, we will see everybody next month, hopefully. And again, thank you, Lora, for everything. Thank Thank you
You're
for your
very welcome.
participation and your willingness to help us out. Thank you.
All right.
Bye, everyone.
Bye.
Take care.